Good afternoon, everyone. So just wanted to send a quick update for anybody that is going to be submitting for the MRCGP RCA in November afterwards. The Royal College has announced two really big changes to the cases that you need to submit, and then about the level of challenge of cases. Okay, so in terms of case selection, previously there was a recommendation that you should try to submit, a range of cases, and that, try to include certain types of cases. But now there's a list of case types that are mandatory. So if you make a submission and you haven't got the mandatory cases, you're going to fail the exam. Okay, so this is really, really important when you're picking your cases and when you're trying to submit your recordings. You want to make sure that you meet these minimums. So what are the mandatory cases? You've got to have at least one case that is related to a child who's 16 or under. Now, that might be the child themselves, for example, a teenager or an older child, or it could be a child with a parent, or, for very young children, it could be a case by proxy, i.e. mum or dad has phoned you or is doing a video consultation, but the actual consultation must be primarily about the child, okay? At least one case has to be an elderly patient over 65 years old. At least one has to be a mental health condition, where that's the primary nature of the case, not someone who happens to have a mental health diagnosis but has come to see you today about their diabetes and they just happen to have a background of depression. Now, where the actual presentation, what they've come to discuss or what you're talking to them about is primarily about the mental health condition, okay? At least one has to be to do with maternal or reproductive health. At least one has to be a long-term condition, and that could be a cancer, it could be someone with a disability, a chronic disease, multimorbidity, that kind of thing. At least one needs to be an acute problem needing urgent investigation or referral. So it might be a patient that you might need to admit, or someone that needs to be seen urgently in hospital for something. And at least two of your cases have to be cases that require clinical examination. Okay, so these are the absolutely mandatory cases. If you don't have these things, don't submit, okay? Because you're not going to be able to pass, all right? And then there are some recommendations. So you should ideally have no more than two from any curriculum area. And you need to make sure that your cases have a significant amount of challenge. So, one of the things that came out from the last exam is that candidates that submitted lots of low challenge cases, they've got a much greater chance of failing. Why is that? Because you've got low challenge case, it's very difficult for you to get a passing score. On average, where cases were thought to be low challenge, people scored about 5 out of 9 marks from each examiner. Okay, a pass is considered 6 or more out of 9. All right, so it's really, really important that you both have a wide variety of cases, including at least meeting the mandatory checklist, okay? And then that you submit cases that have a reasonable level of challenge to maximize your chance of getting great scores, okay? Now, I've updated, you might have used our RCA checklist that I produced before the first sitting. I've updated it to make very clear which are the mandatory cases. I will pop the link to download the PDF below, print it off, stick it on your wall, and then as you're doing your recordings, you can tick off how many you've got from each curriculum area. Make sure you don't get more than 2 in any one, and then tick off all the mandatory ones before you submit, and make sure then that you've got a really good chance of getting the best score possible so that you can smash your RCA. Now, if you are preparing for the November sitting, just to let you know, our RCA Masterclass on how to pass the RCA is running on the 3rd of October. It's a half-day course, so it's going to run from 1:30 till just after 6 p.m. During that, we're going to cover, exactly what's being marked, how do examiners mark, why do people fail. If we look at data from, both CSA and the first 2 cohorts of RCA, and I've had a look at lots of people's feedbacks that didn't do well, but also lots of people that did really well. How to pick your cases, tips on technology, how to get great quality recordings, how to get patients to agree to consent, how to get the right level of challenge into all of your consultations. And we'll actually have 6 interactive cases. We'll do 2 telephone ones, 2 remote video, 2 face-to-face. We'll be having a simulator so that you get the experience of what it's like and you'll be able to get involved, okay? So that's a half day. That's running on the 3rd of October. Remember, if you book by the 21st, of September, you still get the early bird price, which is £125 instead of £150. So I look forward to seeing some of you there. But anyway, I hope you found this helpful, and I will pop the link for the checklist in the links below. Thank you so much. Keep pushing, prepare, and you will succeed. Thank you.